Okay, now that our fish is anaesthetised, it's time to remove it from the anaesthetic and go through the tagging process.
14, 15 grams, 430.
So Jono's placed the fish on the surgery table now. This table has a gill irrigation which contains an anaesthetic, and we also inject oxygen into the water to sustain the fish during the time it's having surgery. So to commence with, we wash any contaminants off the fish with some saline. The fish's mucus layer is the ultimate protection for the fish. Then we're looking for our incision location. Generally we like to go along the linear alba, which is this line along the bottom of the fish, and we're looking to be posterior to the pectoral area, so we're looking at this section of fish here. And what we're going to do is make a small incision through the outer layer of the skin. Sometimes you might have to move a scale away. Like that. So we're not pinching the flesh here, we're just gently lifting it. The idea is we're trying to avoid damaging anything inside the fish. We're just making a gentle incision. We're putting a V13 tag in this fish, so we're looking to make an incision of about 15 to 20 mils long. Generally you want to make one clean incision. Prior to putting the tag into the fish, we remove it from the antiseptic bath, put it in saline to wash any of the anaesthetic off the tag. We then use the forceps just to lift the tissue a little bit, slide the head of the tag in like that. We want to push it lengthways along the fish up into that stomach cavity like that. And just gently push it in like that, away so it's not putting pressure on the incision area. The next step is we take a needle holder. We're using a monofilament suture here. And we're gently lifting it up and through there, making sure not to puncture anything inside the fish. Back through. We're trying not to lift too much on the fish, so we're not trying to pull or tear or put too much pressure on the wound area. And we're looking for a bite, which is the distance from where the needle goes in away from the incision of approximately 5 millimetres. And of an incision about this length, we'll look at doing 3 sutures, evenly spaced. What you're trying to do is actually get in underneath the scale. The scale will quickly blunten the needle and make it very hard to bring it back through the tissue. So the next step is actually to complete each of these. We use a interrupt suture. We do 2 throws of the needle like that. If you end up with any scales like we have here on the thread, just remove them, get them out of the way. Okay. Now what you're looking for is that your closure is not causing the skin to pucker up or for the skin to be folding in or overlapping. So you're looking for a nice meeting of them. Then you're trimming these off about 3 or 4 mil away from the ball of the knot.
It's important at all steps of the process that we keep the conditions sterile. We have antiseptic for all the surgical materials, and we make sure that the person doing the tagging is wearing gloves to protect them and to also protect the fish. So we follow this exact same process in the field. The main difference is that we're capturing the fish from the river and we're returning the fish to the river after it's recovered from the anaesthetic and the surgical process.